If you're in pain, you don't want to live with it. You want to get rid of it. And I empathize with my patients who are in pain because I can never fully understand what they're going through. So the desire for a quick fix is real and it's very understandable. But the quick fix comes from a lot of the interventional procedures we do, which is find the nerve that is responsible for pain and tell it to calm down, not opioids. Because what happens with opioids, you take opioids, it goes all over your body, including non-painful areas, and you can't really control the effect it gets on your body. So when my patients come to me and they need opioid, if you haven't had surgery recently, you don't get opioids from me. Opioid is only indicated anytime between 6 to 12 or 6 to 10 weeks, okay, after surgery. Above 12 weeks, there's higher risk of addiction, higher risk of getting into car accidents, and even higher risk of the patient's the opioid not working, because opioid by itself causes pain. It's called opioid-induced hyperalgesia. So patients wonder sometimes, I feel good, but how's the pain? It's still there. That's opioids, So again, there's a lot of educational part that patients are aware and not aware of, and my job is to help them get through it. Opioid therapy works not for chronic pain. It is controversial in terms of the efficacy of opioid use for chronic pain. So when patients come out to me and they've had chronic pain and are on opioids, I'm very upfront with them. I tell them, I can help you, but not by refilling your opioid prescription, but by offering you everything else that you should have had instead of opioids. We just talked about some of them. We've talked about the exercise part. We've talked about postures. We've talked about sleep. A lot of things that they can do that they probably were not aware of. We'll spend the time to learn together on how to maximize that. And you know what? Like I said at the beginning, your body is smart. It knows what to do, but sometimes it needs a little help. And if it needs more help, they can come back to the clinic and I'll offer procedures. These are office-based procedures. Take 3 minutes, 5 minutes. And what we do is to help the body to regain function back to the original things we just talked about that they can do. So if a patient who has opioid comes up to the clinic, it's not a pleasant conversation because opioid does a lot of things to the body. And I tell them, that's why you want more. So it's not your fault. No. It's not your fault that you want more. It's not your fault that you know all the opioid medications. But it's partly what we have failed to do as providers, So my answer is when they come to the clinic and they ask for treatment and they're on opioid, I offer them everything else but opioids. I offer them injections. I help modulate your nerves. I tell them how they can optimize your sleep, how they can alter your diet, how they can retrain your brain to drive the pain down to almost minimal. It takes time. My common quote is we're driving together in a semi from Texas to Michigan at 20 miles an hour. It's not going to be fun because I'll be boring sometimes, but we're going to get there. So it's a journey for them. And some patients buy into it, some don't. But I'm willing to work with them. I am a firm believer of nutrition. What you eat, and I tell them right away, I'm not your weight loss doctor. I'm your pain doctor. So there's certain kind of diets that you eat that actually have anti-inflammatory properties. But a lot of patients don't know about it. So when you ask about things to do, there's postures, there is the diet, food that you eat that can have anti-inflammatory property to help with pain. And then there's also easy things like exercising. And I'm not talking deadlifting 500 pounds in the gym, just from how you move your joints. And then, in addition to exercising, simple things like meditation. Because I tell a lot of my patients, pain is not just you cut your hand and it hurts. There is a cerebral part of pain. In fact, the mechanism for pain is it's going up to your brain and you say ouch, and then your brain sends information down to reduce the ouchness. Really, that's what I tell patients. So part of what's very powerful with things you can do before you come see a pain doctor is meditation, Tai Chi, yoga. Because you know what you're doing indirectly? You are stimulating and retraining your brain to reduce how much it hurts. So I approach my patients by looking at multiple areas that hurts, multiple sources of the pain, where they're coming from, and give multiple holistic therapies to address it.